How C-section scar tissue impacts your bladder and uterus. Have you ever wondered how a C-section scar can affect your body long after surgery? Understanding this can help you navigate your postpartum journey more smoothly. After a cesarean section, scar tissue forms as part of the healing process. This tissue, known as adhesions, is made of collagen fibers and can create unusual connections between your organs, including your bladder and uterus. For your bladder, this scar tissue can cause it to stick to the uterus or the abdominal wall. When this happens, it may lead to bladder irritation or a pulling sensation. You might notice symptoms like frequent urination or a sudden, intense need to go, known as urge incontinence. This can occur because the scar tissue pulls on the bladder as it heals, tricking your body into thinking it is full even when it is not. Sometimes, the scar tissue can trap nerves or muscles, leading to issues with bladder control or pelvic muscle function. In rare cases, if you need another surgery, like a repeat cesarean section or a hysterectomy, dense scar tissue can increase the risk of bladder injury. This is because the normal tissue layers are altered, making it harder for surgeons to navigate safely. Now let's talk about the uterus. Scar tissue can create adhesions that limit its movement and flexibility. This can affect how the uterus functions and may complicate future pregnancies. For instance, if scar tissue develops near the previous C-section scar, it can increase the risk of abnormal placental attachment. This condition, known as placenta accreta, occurs when the placenta attaches too deeply into the uterine wall, which can lead to serious complications during pregnancy and delivery. So, what can you do about it? Managing C-section scar tissue is essential for a smooth postpartum recovery. Gentle scar massage can help improve tissue mobility and reduce adhesions. Targeted pelvic floor exercises are also beneficial. These can help retrain the muscles and nerves affected by scar tissue, improving bladder control and pelvic stability. Additionally, if you are planning a C-section, a careful surgical technique can help minimize scar tissue formation. This can lower the risk of complications related to the bladder and uterus in the future. In summary, C-section scar tissue can impact your bladder by causing adhesions that lead to irritation and control issues. It can also affect your uterus by restricting movement and increasing pregnancy risks. Focusing on postpartum scar management and pelvic rehabilitation is key to supporting your recovery and overall well-being.